Our guest today is Jason Chiriano. He is the president-elect of the Southern California Vascular Surgeon Society, involved in numerous professional vascular associations, as well as ongoing research projects in regenerative medicine, endovascular, aortic aneurysm repair, and limb preservation. Pretty heavy stuff going on here. Dr. Chiriano is a fellow in the American College of Surgeons and a registered physician in vascular ultrasound interpretation, and is also a medical director. Dr. Chiriano and the dedicated staff at the Vivalife Healing Centers are committed to providing you with an exceptional healing experience administered with compassion and personalized protocols backed by superior knowledge, skill, and professionalism. We strive to implement therapies that will help maintain optimal wellness and quality of life for everybody. You'll find out more about them at Vivalife Healing Centers on Instagram and www.viva.life. Jason, welcome to the show.
Thanks for having me.
Well, you know, what's fascinating is for whatever reason, I seem to connect with vascular surgeons starting about 13 years ago when my friend Dr. Horst Filzer, who was the first guy that put the first stent in the body, became a friend of mine, and just saw him recently. Great guy, he's about 80 now.
Wow.
And we talk a lot about this. I just had Dr. Alejandro Younger was in today, another vascular surgeon, and here we got another one. So I don't know what's going on with the heart, but welcome to the show.
Thank you. Thank you for having me.
So maybe a little background, because what's interesting here is you have kind of what on the surface would look like two competing fields. You have traditional, allopathic Western medicine from a surgical perspective. And then you also have this whole regenerative biologics section, which is on more, some people would call it a more holistic healing methodologies using some of the state-of-the-art stuff. How did you come to bringing these two concepts together?
Yeah, that's a good question. So, I'm an osteopath by training. So in general, I already had a bent towards holistic medicine. So, through our training, we got the whole chiropractor training, we got alternative medicine, even we had some courses on herbology. And so I always had that. As I went through medical school, there was only one thing I knew, that I did not want to be a surgeon. So through my medical school training, I ended up my third year rotation out at San Bernardino County Hospital. I did a surgical rotation, and I just fell in love because I loved the fact that I could cure people with a knife. And, they went home, I saw instant improvements. And so that really caught my eye. So as I went through my training, I started my residency in 2002 and then ended up 5 years of general surgery, 2 years of vascular surgery up through 2009. So I ended up in a field that deals with really end-stage disease. And now I've been doing that for over 10 years. And what I found throughout my career so far is that, the fact that I'm dealing with this end-stage disease, there was something that was like, well, can we do something different about this? Why are these patients getting to this point to begin with? And it really started to be very unsettling with me when I was, doing amputations on people with diabetes, the smokers, the people with high cholesterol. So I started doing more research into this, and I started looking at the geopolitical view of medicine and how medicine's practiced in the United States, and I really got a bit disgruntled with how medicine was being practiced. And what I feel that Western medicine is doing, and particularly with big pharma, is that they're really keeping people sick, and they're not focusing on wellness. And there's agendas that we don't need to go into on this podcast, but so I deal with the very end stage of this, and so I started thinking, well, maybe I can help people not get to this point. And so I kind of had to change my philosophy on how I was looking at patients. And so that's how I came to be involved in, more regenerative, more wellness, biohacking, and that kind of thing to see if I could help patients in a different way.
How do you see, in that evolution? Because I think there's a lot of medical doctors who have friends and stuff who came into practice a noble cause and to help people who are not able to help themselves or don't have the knowledge or capabilities or understanding. And yet, what's that like, finding yourself caught in a system which is oftentimes handcuffing the professional to do their actual job? Right. Was that part of what led you to it, or was it just simple man, we got to stop so many people getting to the end stage first? Many of these conditions are preventative.
Yeah, I think it was more on that end of things for me, because like I said, for my field, most everything I deal with is one disease process, and it's atherosclerosis. And so all of that atherosclerosis affects the blood vessels to the intestine, the aorta, the strokes, heart attacks, everything. So, and it's really preventable. I mean, there's some genetics that are involved, obviously, but a lot of it's lifestyle, a lot of it's diet, a lot of it's, what your choices you're making along the way, and not allowing your body to be in an optimal state to heal. So that's where it was for me.
One of my friends, we mentioned earlier, Dr. Filzer, had told me that one of the most remarkable things that he found as being a surgeon, he says, is I'm essentially doing strategic damage to the body in order to remove the most inflammatory piece or sew something up that's been damaged, right? Oh, yeah. And he goes, but then I come back, to check in on the patients, and I literally witness this healing process that happens, and the person heals from the damage of the original damage, and then whatever I've done, he said, and it was a remarkable process. Would you say that regenerative biologics is, I would say, the amplification of the body's capacity to recover or to heal?
Oh, absolutely. So that's an interesting point, because I probably operate on the sickest. I operate on patients that should not be operated on.
Wow.
Point blank. Like, these are not the patients that you want to be putting under general anesthesia. These are not the patients you want to be creating an inflammatory state where you're forcing their bodies to heal, because they already have such a low physiologic reserve. So what's remarkable to me is, like you said, is that these patients actually do heal, even in that state. So the human body is just amazing in its capabilities to heal, even in a very degenerated state. So you add something like a regenerative biologic to that, you get the paracrine effects, you get the actually direct regeneration or repair of the tissue, enhanced by these regenerative biologics, and it absolutely amplifies. And I think there'd be a huge role for this in post-surgical states,
And what was the thing that made you jump, maybe, or dive into this whole regenerative world coming from your position? Was there a moment? Was there a thing? Was there an impetus? Was there a person? Was there something that set you into? Was it experimentation?
So that's a good question. So my mom, who recently passed, but she was very sick. She was a heavy smoker. She had a lot of health issues, and she was going doctor to doctor to doctor, and she really wasn't getting good help. She had a broken hip. She underwent surgery. She had chronic pain for a long time. Nobody could treat her. She went to several different doctors. All they wanted to do was remove the hardware. They weren't focusing on any physical rehabilitation. Maybe let's look at your lifestyle. Let's do this and that. So she just stayed sick. So our family friend, Phil, who has now become my business partner, we started talking, and that was kind of the moment for me where I was like, maybe there's something we could do for her. So she was actually one of my first patients, and I actually did stem cell therapy on her. She had a horrible neuropathy, and I injected biologics to her, and she was unable to walk up and down the stairs. Within 2 weeks after doing that, she was walking up and down the stairs. So that was kind of the moment for me where I'm like, wow, like there's something to this.
Right.
After years of her suffering, and I just treated her with this, and in 2 weeks she's remarkably better. How do you explain that? And I've seen it over and over and over again now, with patients that have had chronic debilitating issues, that you do 1 or 2 treatments of something and all of a sudden they're a lot better. So that's kind of where my mindset switched.
That's pretty cool. Now, who's the type of patient that's coming to your clinics, and what is the general company? Because is that different than kind of like the end life person versus someone else? So can you kind of classify that shift maybe that's been happening in your
these are patients that have chronic conditions. They've seen doctors after doctor after doctor. They're not getting better. They're searching for something that's going to enhance their life, help their body heal, something. They're kind of at their end of their rope, and that's kind of where we kind of step in and say, well, let's try something different. Mm-hmm. And I think that's something unique about our center, is that we're actually combining a lot of the biohacking with regenerative biologics. And so it's just like anything else. You look at a disease like AIDS. It's not one drug you treat AIDS with. It's a combination of things, right? It's something where you're looking for benefit, and then you're combining modalities to try to maximize the body's ability to heal, whether that be through nutrigenomics or hyperbaric oxygen, which is a whole another topic we can talk about, and then combining that with biologics, so you get that optimal effect of everything, like the sum of the parts, the whole is greater than the sum of the parts, right? Yeah. So that's what I really like about what we're doing with that.
So when someone comes into your clinic, what is the process that they would undergo to determine what might be the best approach in order to do this? Because there's so much stuff on the internet and variance in degrees of quality and expertise and strategy that's being implemented. Right. How do you determine the right regenerative strategy for someone when they come into your place?
Yeah, so I do a full medical consultation for them, which I think, being a Western or traditionally trained medical doctor, I do have a lot of experience with eliciting. I think I have a good 360 view of the body. So I do a full medical consultation. I have them bring in all their medical records. I bring in their imaging, everything. So I do a full comprehensive evaluation. Oftentimes they'll come in for one thing and I'll find something else, and so, but it's a tailored approach. I don't put any patient in a box. We just meet, we try to meet what they need at that time. So there's no specific algorithm that I do. Every patient gets a tailored treatment approach to what I feel that they need. So
that's cool.
Yeah.
I know there was a lot of uproar, I think, when the 2 administrations ago they started centralizing the treatments for the doctors when dealing with patients. Is like you kind of send your stuff into Washington and out comes the algorithm based on the age all that. And it's like it takes all of your personalized training, just eliminates this for a digital thing, which they're probably related to, well, what's the tax value of this person, versus what that person might actually need.
I mean, I used to work for a government agency. I worked for the VA for a long time. So there's a lot of that protocol and process and protocol, and everything gets, kind of put into a box of, what's most efficient, but it's not tailored to each specific patient, So I think it's really important. Nobody's the same. Nobody's the same.
So how would you classify what would fall under the category of regenerative biologics? Like, what are all the categories that are potential out there? And you don't have to say that which ones that you're using or whatever, but what would fall under that category? Because it's a very cool sounding name that people might say, what is that, right? Right.
Well, so if you want to talk about the future of regenerative medicine, we can talk about what there is now and what there could be coming in the future.
That would be great. That'd be great.
Right now we have pretty much stem cells, which you can get from several different ways. You can actually harvest it from the patient's own body, or you get it from umbilical cord blood, which is probably a better way to get it. And those are pluripotent cells. They have direct effects as well as indirect effects. They stick around in the body for several weeks, but they also have what's called paracrine effects. So they enhance the body's own ability to recruit growth factors and repair tissue. And then there's things like PRP, which is platelet-rich plasma. So that's where you draw blood out of a patient, spin down the platelets, and then inject it back in. I would say that gene therapy, the way it's going now, would be considered a regenerative biologic as well. But if you look at what's going to be happening in the future, when you're talking about scaffolding of organs, keratin uses as scaffolding, and then using induced pluripotent cells to, manufacture organs. Those are things way in the future. But these are the types of regenerative biologics we're talking about now.
Where would you classify, say, things like exosomes, NAD, fast vites, these kind of things, which are permeating the biohacking? I was just out in Arizona and I got shot up with some NAD and some fast vites, and it was awesome. You feel amazing relatively quick.
Very quickly. So specifically exosomes, exosomes have been signaling molecules. Yeah. So they work pretty similar to stem cells, and a lot of the research out there is showing that they work almost as good as stem cells. And the good thing for the public is that they're much cheaper than stem cells.
Right.
So on a more affordable level with getting good efficacy, they would also be classified into the whole regenerative biologics as well. So, and you can inject these either IV or you can inject them locally, depending. on what you need them for.
Now, how does those things, because, I'm talking about the synergistic effect you rolled in, is like, okay, so now, let's say I got a bum shoulder, we come in, we take a look at it, you go, okay, we're going to walk you through this process. Let's do an evaluation, a medical evaluation. Is there damage? Is there MRI? Is there this, all that sort of stuff. And then we said, okay, we're going to do stem cells, some exosomes. We're going to put you in a hyperbaric chamber. Like, how does that combination kind of emerge? Is it like what I'm specifically trying to get at is how does the medical side of things work with the biohacking side of things?
So for me, a couple things. I think most disease is inflammatory.
Correct. The silent killer.
Silent killer. And nobody knows their inflammatory state. And you deal a lot with diet, nutrition, and you know that the United States diet is all inflammatory, right? The Western diet's all inflammatory,
Brutal.
right? So, if you can take down the inflammatory state either through diet, nutrition, and then the other thing you need for healing, aside from decreasing the inflammation, is that you need blood flow. You need oxygen delivery. So a lot of injury in areas like the shoulder, when you're dealing with cartilage and things like that, they already inherently have bad blood flow. Mm-hmm. So if you're injecting stem cells in that area, it's great, but you need something to augment the blood flow. You need something to augment that oxygen delivery. You need something to decrease the free radicals in that area. You need something to maximize the nutrition in that area. So you combine their nutrition with supplements or enzymes or whatever. You augment the blood flow through adjuvant therapy such as sonic therapy, PEMF, hyperbaric, and that augments everything that you're doing with the regenerative biologics. So you put that all together and you get a very synergistic approach to what happens.
What are some of the common biohacking technologies that you feel accelerate or amplify the regenerative biologics?
Yeah, so I think, I think that there's a lot of the cognitive therapy that actually works. If you can get patients, their bodies into a relaxed state, that will optimize their ability to heal. So things like brain tap, things like, and I would even consider PMF to be a biohacking sort of thing.
Yeah.
But anything that can get the body into a relaxed state. There's phototherapy. I don't know if you've heard of LifeWave or not, but these phototherapy patches, the body emits infrared light. You get that wavelengths absorbed, re-emitted into the body. It can actually trigger the nervous system in the brain to enter a state that you can actually harness the energy of the body to heal in that area as well. So I think there's definitely those types of biohackings that are great. But I really think if you could, a lot of the psychology in biohacking is really, really important. And getting in touch with where your frequencies are, where your brain waves are, and getting those into relaxed states, while you're healing will improve your healing as well.
Is that because of the sympathetic parasympathetic switch kind of that gets flipped, and that's a big requirement?
Right.
People are kind of on all the time now.
So if you're in that sympathetic fight or flight all the time, your cortisol levels up. We know that cortisol isn't, even though it's anti-inflammatory, it's also anti-healing. So steroids, really prevent healing. Cortisol is a steroid. So anytime you're in that fight or flight, your heart rate's up, your stress levels are up, you're not going to heal that as well. So you gotta, through either meditation or biohacking that puts you into a meditative state, it's going to help, with your healing as well.
So when you come up with this combo, so someone goes, I guess in some cases, are you actually doing surgery in the situation and then doing some of the other things?
No, I actually,
you don't combine the two.
I don't combine the two because, although in the future I may, because, but I'm kind of trying to keep them separate right now because it's a different type of patient that I'm dealing with.
And regulatory must be also a minefield.
Yeah, regulatory, nothing is covered by insurance. What do we do on that side? Whereas there's no way that patients can pay cash for surgery, obviously, so I have to take insurance on that side. So, it's just best right now that I keep it a little bit separate. But yeah.
That totally makes sense. Now, let's talk about specifically your clinics, where you're located. What are some of the things that you're doing at the clinic that, you can kind of be as vague, but kind of explaining maybe the process?
Yeah, so we're in Rancho Cucamonga. We're right off the 210 freeway out there, Vivalife Healing Centers. So we're doing regenerative biologics, we're doing biohacking, we're doing hydration, we're doing nutrigenomics, so sampling DNA, and then creating compounds that will, be specific for a specific patient's DNA. Because when it comes down to supplements, a lot of times you don't know what an individual patient needs or how their body's going to absorb a certain combination. And a lot of patients go to GNC and they just get this supplement and that supplement and this and that, and just combine everything. They're spending $700-800 a month, just hoping to get a benefit. And you're in the business of that, so so if you can make something that's more customized to a patient, it's a lot easier.
Yeah, I know one of our, we have a research center in Croatia where we have a partnership with a university over there. And we send in our products and do all sort of hermetic stresses. And we also got a genetic engineer expert on artificial intelligence, a microbiome specialist, a specialist in neurophysiology, just coming on board, and a specialist in neurochemistry. And then now another one is a docking agent, someone who can actually determine the combinations or specifics of extracts and how they dock on the cells. And so we're putting all the geniuses in the lab, and then we can run the test. We just bought a new test, an HPLC machine, that we can actually take apart, see what's getting absorbed, what's getting utilized, what's not getting along, and then marrying that over genetics and epigenetics, which I think is going to be the future of delivery. So every person will have super customized. And right now, that's mostly accessible to elite VIP folks who have the disposable income. But what we learn from that, or what we get from the generalized stuff, is we can make nutritional supplements on a wide scale, on a bigger scale. They're still premium priced, but they're far more effective than your typical product. And I do believe that total customization is where the future will happen.
It has to be. I mean, you can't put everybody in a box.
No.
Yeah. So I think one of the big problems we're going to face in the future with all of this is just regulation. It's going to be a problem.
What is your experience? Let's talk about that, because I feel that for the great part of the history of this country, the United States, which I am essentially a resident of, an immigrant, if you will, what I love about the American spirit is it's unique amongst the world. It's a can-do attitude. Let's do this. We can build something new. We can do what's not been done before. We're excited about the challenge. Yet somehow over the last couple of decades, and particularly accelerated in this last one, there is this super regulatory and limitation seems to be going into every aspect of society, whether it's vaccinations, whether it is the legalities of regenerative biologics, whether it is who gets access to what. What is it like as someone who's inside that regulatory field, and it just keeps piling on and stifling development? What's your feelings about that? Are we going to be able to make gains to kind of reverse this trend?
And now for a Bioptimizers fixed digestion tip, rapid cheat meal relief. Research shows that cheat meals can actually be an effective way to boost your metabolism. One key weight loss hormone, leptin, can be increased by up to 30% following a cheat meal. The challenge with the cheat meals is that all those extra calories and lower food quality can be hard to digest, which means you could be totally sidelined with a food coma after big cheat meals. The solution is to take strong digestive enzymes like masszymes, which will help rapidly digest and break down the extra food. 3 to 5 capsules before or right after your cheat meal can make a huge difference in how you feel following the cheat meal. If it's a cheat day with multiple large meals, you might want to go up to 10 capsules or higher to help you power through all that food. To save 10% on masszymes, go to masszymes.com. That's MASSZYMES.com and enter the code CHEAT10 at checkout.
Well, I guess so there's a couple forces at play. So you have a division which is inherently, really difficult to transcend. So you have the physicians, and then you have pharma and the FDA. Physicians are not allowed to unionize. We have no lobbying power really as physicians. It's very hard for physicians to unite together and create a stand against some of the stuff that happens. The other thing is that the public is fed a certain amount of knowledge, And we don't know.
Or propaganda.
Or propaganda.
Would be a more appropriate title, well, I think.
So the public is given whatever propaganda, and it's very limited, So you look at something like COVID. I was just listening to a testimony from the senator from Texas, and he was talking about how if you look at all of the information that's out there on the internet, there's no information about COVID treatment. And so everybody thinks this is an untreatable disease, and what he was saying is it's not an untreatable disease. But the problem is the public doesn't know what to do. There's no information about what to do once you're diagnosed with COVID. You're just said, you're diagnosed with COVID, now go home. And then these patients end up in the hospital. And now since the vaccine came up, any information about treatment is scrubbed. And so all you hear about is vaccines. So.
Right, unless you're listening to what's called the intellectual dark web, with guys like, Brett Weinstein,
right.
An evolutionary biologist who's getting the creme de la creme of the intellectual virology. But this is not, he's being squelched on various platforms because he's like, hey, there's prophylactics, there's nutritional therapies, there's other things that could be used very cost effectively in the country. And he's not a hair on fire kind of guy, and him and his wife Heather walked through the science impartially. The stunning outcome that comes out of it is that it seems that the government is actually accelerating the problem as opposed to solving the problem. Like the more intervention they seem to want to regulate or control or manipulate, the more stifling they become to the real solutions to the problems.
Absolutely, and so we see the same thing on the regenerative biologics. So what incentive is there on a big pharma standpoint for regenerative biologics if they don't control it, right?
So the question comes, like, how do we as citizens, and I did a recent podcast recently, and I said, hey, look, we're the government and these are our representatives. It's not the other way around. It's bottom up in this country. But how do we as citizens take action to reclaim the innovative spirit that has made this country so great for so long?
That's a good question. I mean, of course you can appeal to your local representatives, but I really think it's just appealing to your local physicians. It's appealing to what's out there and seeking out. I think you have to be your own advocate, really. I mean, you have to be seeking out your treatments. You have to be a free thinker. You have to be coming to our clinic, coming to people like yourself that are going to be more involved in that kind of thing. But, it's going to take a lot of banding together and then, appealing to local government to try to even get a place where you could actually have a platform to appeal to higher ups. Right? To even get to that level, it's going to take, a lot of banding together for that. But, there's a 36% increase in the demand for regenerative biologics every year. So at some point, there's going to be a tipping point where people are going to say, we've had enough of this. And that is a good thing about America. Enough people come together, something will change. But there's going to be a lot of pushback when you have billions and billions of dollars hooked up into big pharma.
Right, which also contribute to political campaigns, right? Which then set policy.
Right.
And also it sets regulation to opposing institutions, which, having been in the nutritional supplement industry and coming out of Canada, a highly regulated environment, and each year they keep trying to just move the stakes more and more towards taking the power of regeneration out of the hands of the people and putting the pharmaceutical intervention modalities, which don't solve problems, they treat symptoms. And that's right out of the New England Journal of Medicine. We don't treat diseases, we treat the symptoms of diseases.
It's Band-Aids.
Yes.
Right, so you look at people on 4 or 5 different medications, it's all Band-Aids, right? They may feel better, but you're not treating the underlying problem.
Yeah, you're just pulling the fuses on the red lights in the car.
Exactly.
So, at your clinics, what do you feel like what's your mission and where are you driving towards on this whole process?
Yeah, so our mission is actually to create a state in everybody that they can heal themselves. We don't want to treat people over and over and over again. We want to get them into a state and have them not only be able to heal themselves, but also have a mindset that after they leave our clinic and they're done with our treatment, that they have a new philosophy on their own health. So we want them to have a kind of an epiphany moment that they need to have their own, be their own advocate for their lifestyle. You know, we can heal them to a certain point, but we do a lot of counseling as well, and
Right.
you know, changing their mindsets about their own health. So,
what do you see as the future? Like, if you can fast forward to, say, 10, 20, even 50 years, what do you feel is the future of this industry and how that might impact humanity at large? What do you imagine?
well, I would hope that the way things are going right now, I think that the public is at an all-time high of wanting something different, especially through the pandemic. So I would think that over time, that as people are more open-minded about, you know, the disadvantages of Western medicine, that there will be a shift of how we deliver healthcare. And I'm hoping actually it would be a hybrid. I'm not saying there's not a place for Western medicine. There clearly is, you know.
Absolutely.
And I'm not saying we need to get rid of surgery or get rid of
acute care.
Acute care is
world-class.
very important, and America has one of the best healthcare systems, you know, in the world. But you know, there has to be this shift towards wellness, and I think that there is a momentum for that, especially through the pandemic. I think the pandemic was a huge wake-up call for a lot of people on their health. So I would say in 20 to 30 years, if the things continue going the way they are, I think number one, hopefully it'll be more accepted in mainstream. The knowledge that's out there, the research studies that will be done will make it maybe more of a platform that third-party payers will pay for it. Because I think if you have enough research out there, it's hard to deny benefit. The problem with a lot of the biohacking right now and a lot of it's not quantifiable.
Correct.
And so when you're looking at science, you know, when you're looking at FDA, you're looking at regulation, you need quantifiable results. Now we're moving in that direction. I mean, there's scans that, you know, you do after brain tap and things like that that show the changes in the brain, but there needs to be more white papers out there. There needs to be more scientific studies that show the benefit of, the benefit's clear. It just needs to be documented.
That's one of the things that we're working on at our university partnership in Croatia, because unfortunately we have to go outside of North America to get value on the dollars invested, because right now it's highly cost impactful by setting up what I can do in an externalized university setting. I can get a fraction of the price, same quality, same, you know, intelligence, horsepower, and structure at a fraction of the cost. And that alarms me from the standpoint is like, what is our best and brightest doing? You know.
So the United States is notoriously difficult to get research studies done.
Yes.
I was in academics for a long time. I mean, going through the IRB and getting everything, Institutional Review Board, everything, it's very difficult. It's very regulated, you know, so there's only a certain amount of studies that even ever get done. So a lot of the studies that come out of Europe. They come out of other countries, like you're saying, because it's easier to get the studies done in those countries.
Right.
And some of the like top therapies that come out of Europe first, and then we adopt in the United States. So I think you're doing the right thing. I think you're gonna get more benefit, you know, doing it out of Croatia. But my point in that is that, you know, maybe it's going to take those types of studies over time, you know, the knowledge base, what's out there as far as research to justify what we're doing in the biohacking world, in the regenerative world, to make that paradigm shift and make it legitimate in the institution's eyes.
So as a medical doctor and a director here of a regenerative clinic, what's a day in your life look like? From both a professional level, but also like, what are the things that you do in order to maintain robust health?
Oh, so, well, so that was one thing. So going through residency and everything, you know, I was working 140 hours a week. There's only 168 hours in a week.
That's insane.
So, you know, I'm a bit advocate of physician burnout, treating physician burnout, because I was a victim of physician burnout. Depressed, no energy, kind of lost my passion for what I was doing. Mm-hmm. And it's funny because, you know, as doctors, we're always telling people what to do, but we're not taking care of ourselves.
Yeah.
Right. And the institution just doesn't want us to, especially in surgery. I mean, I remember passing out on the operating room table and during a surgery when I was a resident, and just getting woken up and said, come on, keep going, you know? So
wow.
So by the end of
That's so mind-boggling, right? You got someone else like.
So by the end of my residency, they had instituted an 80-hour work rule. So you could only work 80 hours
That's
a
it.
week.
You can only
work 80 hours
what
a week.
What a joke, right?
Yeah, right. And so that was their attempt at, at restoring health in physicians. But, when you look at depression rates, physician suicides at an all-time high. Vascular surgeons actually have the highest suicide rate of any subspecialty in medicine. And so there's all this new recognition of physician burnout. So, what I try to do is I try to at least get a good night's sleep. I try to eat as best I can, exercise when I can. So those are the things that I'm doing. I'm doing my own biohacking. I use the brain tap. So I can be better at it, but I'm still making that transition between the surgical world and my world of regenerative medicine. So I still do have a surgeon's lifestyle, which is sometimes not the best on.
Right, because the gunshot wound or the car accident doesn't happen at noon on Tuesday. It happens at Saturday night, 1 a.m., 2 a.m.
Yeah, you never know when it's going to happen. You never know when the patient with the ruptured aneurysm is going to come in. So my sleep patterns are disrupted quite a bit. I'm taking the calls in the middle of the night. So. But for me, it's been a huge journey on self-care, and I'm still in the middle of it. It's like a recovery program from what I did in residency, and how it just becomes it's almost like you're institutionalized, and your lifestyle as a surgeon. And so breaking out of that is very difficult.
Do you think that regenerative biologics is going to be hopeful that we can lead the way, or is the regulations going to push it out of the country into jurisdictions which become more friendly? Because we're now seeing, medical tourism that has came up in Southeast Asia, in India, even people going across the border for dental surgery down to Mexico and stuff. Do you see this starting to happen, and what is the impact for the American citizen?
Yeah, so I mean, it all depends on how the FDA regulation goes, because as of recently there was a moratorium put on biologics, and so people have been going down across the border to do that more often. So, but I'm still hopeful. I think that over time, if we get the research done, if there's a public demand, I think that the United States, I'm hopeful that actually it will become a more mainstream therapy. I can see that happening.
Well, I think it's largely in part being driven by the performance of athletes like, LeBron James and Tom Brady, who are essentially combining state-of-the-art regenerative biology in combination with biohacking, dietary analysis, which was formerly just training and methodologies and nutrition, maybe. Now we've got the whole suite, and when we're seeing these athletes perform at levels at ages that weren't before, I think that inspires the population to drive demand on a big level. Would you agree with that?
I would totally agree with that. Yeah, absolutely.
Where do you think the next big breakthroughs are going to be? We have like David Sinclair talking about, treating aging and death as a disease. Right. Do you see, or where does regenerative biologies fit within, say, longevity expansion, or like how do they fit together, or are they somewhat separate?
I think they fit together. I mean, if you look at some of the anti-aging properties of stem cells, I mean, people are already using it for anti-aging. But I think also, some of the regenerative biologics, when you're talking about induced pluripotent cells, IPCs, cancer therapy, right? So there's actually some research being done of inducing radiated cancer cells into the body, and it's all immunotherapy. So if we can do gene therapy, immunotherapy to treat diseases like that, not only will you treat cancer, but we can also do gene therapy for anti-aging, and then combine that with stem cells. So there's a lot of that. I think the anti-aging is a huge future benefit of regenerative biologics. It's determined by how you can administer them.
Do you think there's a limitation to how old one can live healthily? Or do you see that expanding into the future? Of course, there's limitations to almost everything, but do you imagine people will be living to 150 years old in a couple hundred years? Or
that's a good question. I don't know, to be honest with you. And I'm a little concerned about that. I mean, if you look at the impact on ecology, I mean, what happens to the food supply? What happens to, overpopulation? How will that change the planet? I mean, if you have that many people living for that long, I don't think it's impossible. I think.
There's some fascinating, because we're in this common element, and there's this one movement about environmentalism, and then, there's climate change and that sort of concept, and then we have now a worldwide pandemic, and we have these, what I call evolutionary pressures, which would indicate to me that they're driving humanity to a new level of growth. What do you think about, I had a lady on here the other day that's using artificial intelligence, continuous glucose monitors and heart rate variability, and they're able to predict your blood sugar response 33 hours ahead of before you eat. Where do you see tech, say wearable, usable, injectables, whatever, being as a part of this, or do you think there are some moral and ethical components that we haven't crossed in regards to that?
No, I mean, I think a lot of that stuff's already being done. Like you mentioned, the heart rate variabilities, all of the glucose monitoring. I don't think there's any moral or ethical problems with that. I think if you can get more real-time information about your health and make real-time changes based on the information that you're getting, I think that's invaluable. So I think as tech evolves, we're going to be able to monitor ourselves a little bit better. And I think that also puts the patient's health in their own hands. It makes them accountable for what they're seeing. And
you bring up a thing, and one of the things that I advocate for with our clients and for our business people is recognize, be the director of your own health. In other words, here's your GP, here's your chiropractor, here's your regenerative medicine specialist, here's your endocrinologist, here's your naturopath, here's your team of advisors who work for you in order to give you a more rounded decision possibility tree than, say, just by going to your GP and that's it. How would you say is the best way to encourage the population to take ownership of their health as opposed to just whatever?
I think it's education, and I think it's accessibility to information. I'm not talking about the internet. I'm talking about real education, because you can find anything on the internet.
Right.
But you have to get people inspired, and they have to see, I think especially this generation, they want to see results.
Yeah.
Right? So if you can get patients involved in their care and they start seeing results, and you say, oh, look, you did this, and look what happened. You inspire them. You make them want to make those changes because they can see it. They can feel it,
That was one of the things that I discovered when I was a personal trainer years ago, is I love getting people into the point where they went from disempowered to empowered.
Yeah, you empower them. And so I think you're right. I think in all those are the spokes. The patient needs to be the center. It should be patient-centered care, not physician-centered care. Right? So if you make it patient-centered care, they feel empowered. They feel like they have a responsibility to themselves. You're like their coach, like you said. They will do it.
Jason, where do people find you? Where's your clinics, and how do they come into one of your places and find out everything that you can do to help them become a regenerative person?
So we're at Vivalife Healing Centers. We're in Rancho Cucamonga at the corner of Baseline and Carnelian. You can find us at www.vivalife.health. I'm sorry, viva.life. We changed it, www.viva.life. And you can call. There's a way to make an appointment on the website, and we'll be happy to see you anytime.
Well, this has been a great interview. It's been very informative. Thank you so much for joining us today.
Thanks.
Appreciate it.
Yeah.
All right. Thank you.
Thanks.
And now for a Bioptimizers fixed digestion tip. Turn cultured foods into superfoods. Raw fermented foods like sauerkraut and low sugar, live yogurt can be good for you, but rarely have enough of the right probiotic strains for therapeutic benefit. So here's a way that you can turn them into superfoods. What I do is I get some raw sauerkraut or a healthy yogurt. Ideally, it's grass-fed or coconut-based, and you can empty 3 caps of P3OM into a container and mix it up thoroughly. Leave it at room temperature for a couple of hours before putting it back into the fridge. And what's going to happen is these probiotic levels will be multiplied. In fact, it doubles every 20 minutes. And then what you're going to get is you're going to have a food with strong proteolytic activity. To learn more about P3OM and why its patented strains make it the strongest probiotic available, go to www.bioptimizers.com.
Thank you for listening to the Bioptimizers Awesome Health Podcast. You can find more information at bioptimizers.com.